A pushing before I put any oil on, where I'm just kind of looking at the fascia and I'm just trying to break up some fascia. And we saw a reason today why we want to do that. So I'll start up here, good nice pressure, and I'm just going to use my palms so I'm relaxed at the fingertips. I want some pressure through the index part of my knuckles, or not the index but the intermediate part of my knuckles. But I'm just kind of dragging my skin here, or her skin here, getting some pushing. And that's just helping with a little bit of opening up the fascia. And it gives me an idea of what is going on. Then I'll come back. Get some oil, that's the pump. I don't want too much, that's too much. Alright. So you want to make sure you get oil down at the post-iliac crest area, lower back, lumbar, both sides. Oil up through the middle of the back, forearms. Normally I'd put it on more systematic and graceful and all that, but not today. So what we have is hands first, pushing, and this is pushing technique down the body, back up. You must do this whole thing together. We're not breaking it up. So pay attention and write notes if you have to, because I see it broken up a lot, and Dr. Joe will want you to do the whole thing every time, all in one fell swoop. So we start at the top. We have good downward pressure, right? How's that pressure, Kim? Good. Good. One straight downward pressure. You don't want to have so much pressure that they can't breathe and you're over top of them, okay? So I have good angle, I'm good pushing, good downward pressure. When my fingers get to this lumbar area or up by her sheets, they're going to naturally curl, and then my palms are going to come right up against the post-iliac crest. At this time I'm going to go down, so my pressure is now down and in towards the table, and I'm coming back here. And then what I'm going to do, and this is the important part that a lot of people miss. Notice my elbows are going to make contact. I'm going to grasp the sides and then pull up to get the lats, the attachments of the teres, all the way through subscap. And then I'm going to the back of the arms, making sure that I'm pretty soft here. So my pressure has decreased probably 40%. Really soft over the elbow. I make sure I go on the inside of the elbow. Then I can get a little bit more pressure again down the inside of the arm, get to the hand. Dr. Joe always grabs the fingers and gets a stretch. Then you continue the contact and you're back up. That was one pass. And you can do it this speed. I hesitate to tell or give freedom to do any faster than this, because inevitably I'll see and I think, well, what did you notice? So you can do the hands, and I think like taking 10 to 15 seconds to do the back is a good speed. Personally, you'll know me, I'm gonna say slower is better. Taking 30 seconds to do this whole pass, you're gonna learn a lot. The next thing you can do is fists. You can do the fists together. You can do fists a little bit apart, like rolling. Just doing fists, and when you get down here, all I do is transfer to my palms. So notice how I did that. I just kept my wrists up, and then I just pushed my wrist down so I can get to my palms, and then I let my hands just relax. Now I'm set up to get this part of the pushing. Okay, I'm going to set up to push with my front foot. I grab, then I drag. And you could also fists on the forearms, through the hands. And the third one is the ulnar side. So I'm using from pinky to ulnar, so that's up there. Hands, fists, ulnar. You're pushing. All the way down again. You get down here, let those fingers curl, and then I'll just swoop down to get that palm side contacted. That makes sense? So I'm here, good firm pressure, and all I'm doing is slightly bending my elbows so that I have good pressure here, because it's hard to get them. It's going to go through the fingertips at this point. So I bend my elbows and rotate them down so my elbows are pointing towards the table, and drop my weight, and this allows me to get pressure here. So your elbows have to be down. If your elbows are up, you're not going to get the right pressure. You're going to feel pressure in your wrists. Does everybody understand what that means, what I'm saying there? This is physics. So I'm just dropping my elbows, and I'm able to get a lot more downward pressure. And then at this point, my fingers become relaxed, and as my palms get to the destination that they get to, they switch positions. Now my elbows come out again, and now I'm set up. Here. This is the 3D in pushing. I'll do that later, but I just wanted to show it now because sometimes I'll do that. The other thing you could do, but I would do this whole thing first before I experimented with it, is perhaps get your pushing, come down, and then once in a while I'll also knead, then come down. So you could do that as well. Okay, so that's pushing on the spine. Scapula pushing. What you're gonna do is take your ulnar side of your arm, or your thumb, ulnar side of your thumb. I'm trying to think about what I'm gonna say before I say it. You're gonna take your thumb and this L here, this crook here, and you're gonna put it essentially, for her left scapula, I'm gonna use my left hand because that fits perfectly right there. And now my thumb is this instrument that can go underneath the scapula. But it's difficult to do this alone. So what this guy is gonna do is I'm gonna match up like that. See that? So my fist, or my palm right here, is going to go over top of my thumb. And it's important where this is. If it's not going to be in the right spot, you're not going to get the right approach and the right angle. So the inferior angle of the scapula is here. That goes right in the crook of my thumb. Push down. And I should be able to get underneath. See, we're not getting underneath it. But what we are doing is moving it, which is just as important. So that's the next best thing. Once in a while you can get underneath it, most of the time actually. But if you can't, then I just want to move it away. I want to move it away from midline. And all I'm doing is starting at this Huatu Jiaji. So that's between the spine and the erectors. Okay, there's this little groove here. Everybody knows the groove that I'm talking about. You've worked on the back probably enough to learn that, right? Anyone not know what I'm talking about?
I think I know what you mean.
The groove between the spine and the erectors right here. Here are the erectors, going over them. I'll pick them up. Those are the erectors. Here's the spine. If I lay that down, there's a groove all the way along here.
Sure, sure.
Okay? So that thumb goes right inside of that groove. Here's the spine, here's the erectors. Push down. And then push away. And then after I push over this erectors, which I'm pushing away from midline, I'll get to that scapula. So now I'm doing right hand, and notice my right hand can go underneath. It's got a little bit more dexterity than my left. And then you can also go, you can go either direction. You can do either hand. I want you to do both hands.
Nice.
I just like how the left one fits right underneath. Notice now we got it.
Yeah.
First we didn't get it, but now we've got the tissues pliable enough where they'll slide underneath with my thumb's help. So we got the same thing here. We're pushing away. We might not get underneath it there because there's a lot of attachments right here at the superior angle, the superior medial angle. So we're just pushing away. We're just pushing away, okay, from the spine all the way to the scapula, okay? So that's scapula pushing. Okay. So subscap, what I'm gonna do is put her hand in this position, okay? Now there's two ways I'm going to do this. I'm actually going to do a pulling motion, and I figure if you're pushing, I know what this does. So pushing, I'm using my body behind the motion, and my hand is pushing down the body or up the body, depending on what direction, right? So then I thought, well, what about pulling? I started doing this thing, and I thought, well, pulling is the same as pushing. It's just I'm pulling, I'm not pushing. So I've lumped them in. This is just an adaptation that I do. It's not in the book. So I don't want you to fight me on it's not pushing. It is. It's just reversed. So this subscap pushing that I'll do is sometimes I'll do it with my hand and my thumb. So the inferior hand will always be the hand on the body. This is kind of a crossover, and there's a lot of pressure and tension going through that part of my wrist, as well as compression right here. So we wouldn't want to do that, right? Does that make sense to everybody? Mm-hmm. The most applicable would be driving my pressure through here, because I'm not building up a lot of compression here. My thumb is still strong, but I don't have to rely on my thumb. I can get nice and low and push in here and relax my thumb. And then my pressure is coming from this area, and I'm not having to push through this arm, so everything is pretty well balanced. And all I'm doing is getting up into that scapula. How's that feel, Kim?
Real good.
Getting up into that scapula, and I'll come right down the tricep, trying not to pinch the hair. And the reason that this can work body mechanics wise is because this lunge is a strong lunge. I don't have anything, I'm not holding on, not using her body as a hold. So if you can't do this, or not willing to do this, I would omit that part, because that's not a safe place for you. If you want to just do this part, that's fine. But I will say, body mechanics wise, if you should be able to take your hand off of that person at any given time and have full control of your body. Then you have good control body mechanics wise. So all we're doing is taking the inferior hand, superior hand, going over top of that thumb, pushing up and down the body. Okay, I'm keeping good separation between what's actually scapular, and breast tissue is very anterior, so I have to go a long way. I still have lat attachment down here that runs right along here. So you can see me roll over that. Mm-hmm. Before I'm going to get to anything too anterior and too invasive. So we're safe here. This is a safe zone. Essentially, if there's energetic stuff or traumatic stuff, then we're less safe, but you should hopefully know those people, or at least have a good idea in your intuitional heart. Maybe this wouldn't be a good thing just for safety value. But 9 times out of 10 this works. The other way that I'm going to do this is by pulling. This is where I'm adopting a pulling. So I'll do this from across the table. Personally, I like this better because I can use my body weight in a much better way, and I can just use finger strength, and my fingers are a lot stronger than my thumb is. My thumb takes a big beating. So what I'm going to do is set up in a good base that I can pull with, and I'm going to start down at the lats, okay? Hook underneath the scapula, and then pull. And I'm just leaning back. But again, try not to lean back too much or get in a position where I still have full control. But I'm leaning my body back, which is completely different than if I were up here pulling back. She can feel that. I can feel that. I'm shaking so much because I'm trying to do it. That feels like, this feels like, how's the pressure come?
Good.
Not too much, is it?
Mm-mm.
Is that too much?
Mm-mm.
Okay. So all I'm doing is just pulling right along that subscap, trying to get in and under the scapula. It's a very important place for us to get under. We have to free that scapula up. 9 times out of 10, people are a little frozen there. And then I'll just push down the body with my thumb and my other hand so that I get to the tricep. Okay? So I just continue that all the way down. I don't always do that, but it's a very easy thing to do. You could also just come across the body. I'm in a safe position here, foot underneath the face rest, and use my thumbs and finger in a position here.